Good afternoon, Chair Hilda L. Solis, honorable members of the Los Angeles County Board of Supervisors, county staff, and members of the public. Thank you for the opportunity to appear before you today. My name is Giovanni Figueroa, and I appreciate the opportunity to present a proposal for a public nonprofit partnership between the Los Angeles County Department of Homeless Services and Housing and LA Family Housing. Today, I will present the Mental Health Housing Coordination Program. The purpose of this proposal is to address one of the most complex challenges facing Los Angeles County today, that being of homeless individuals living with a serious mental illness. Through this partnership, I hope to demonstrate how combining housing stabilization with behavioral health services can improve housing retention, reduce reliance on crisis services, and ultimately strengthen our communities. Homelessness among individuals living with a serious mental illness remains one of the most complex and heartbreaking challenges facing Los Angeles County. While homelessness directly affects those experiencing it, the effect extends far beyond the individual. The community also bears the burden through increased demands on healthcare systems, law enforcement, and other public resources. Now, despite the progress made by both the Los Angeles County and nonprofit organizations, significant service gaps remain for individuals who continue to cycle through psychiatric hospitals, emergency room department, law enforcement contacts, and homelessness. To address this issue, I am proposing the Mental Health Housing Coordination or MHAC program. MHAC is a partnership between the Los Angeles County Department of Homeless Services and Housing and LA Family Housing that combines permanent supportive housing, behavioral health services, and housing stabilization. Now, the goal is not simply to place somebody into housing, but to help them remain housed while receiving the much needed services they need. Now, it is often said that society is described as a fabric, a network of individuals, family, organizations, and institutions woven together to form a functioning community. But I think it's more like a tapestry where every person, family, business, neighborhood, faith organization, and institution represents an individual thread. Like any tapestry, its strength depends on the condition of each thread and the support that holds them together. When one thread begins to unravel, the surrounding threads eventually follow. Now, the same can be said about our communities. When individuals experiencing homelessness, serious mental illness, or other significant hardship, those threads begin to unravel. Like a tapestry, our community depends on each of those threads working together. Now, as beautiful and strong as a tapestry may be, it only takes one thread to begin unraveling before the surrounding threads begin to loosen as well. The same can be said about our communities. When an individual experiencing homelessness, especially when combined with a serious mental illness, the effects are rarely isolated to that one person. Families are affected, neighborhoods begin to change, and public resources become increasingly strained. What begins as one person's hardship eventually reaches hospitals, law enforcement, behavioral health systems, and the community as a whole. If left unaddressed, more threads begin to unravel, weakening the strength of the entire tapestry. Eventually, when enough threads begin to unravel, the effects become impossible to ignore. Communities experience greater demands on healthcare systems, increased law enforcement contact, and a growing need for housing and behavioral health services. The quality of life for everyone begins to decline. Fortunately, there are organizations that have dedicated themselves to strengthening those threads. One of those organizations is LA Family Housing. For more than 4 decades, LA Family Housing has helped individuals experiencing homelessness through outreach, interim housing, permanent supportive housing, housing navigation, and supportive services. Now, despite the tremendous work they have done, one population continues to require greater attention: those individuals experiencing homelessness who are living with a serious mental illness. Now, this is a challenge that neither government nor nonprofit organizations can effectively address on their own. It requires coordination, partnership that combines the strength and resources of both. That brings me to the proposal I am presenting today. Now, according to the Los Angeles Homeless Service Authority, most recent homeless count, more than 72,000 individuals were experiencing homelessness in Los Angeles County. Of those individuals, approximately 17,354 were living with a serious mental illness. These are some of our county's most vulnerable residents, many of whom continue to cycle between homelessness and crisis services. Between 2019 and 2020, California recorded more than 896,000 hospital encounters involving individuals experiencing homelessness, including over 237,000 inpatient hospitalization and nearly 659,000 emergency room visits. Research has also shown that nearly 40% of emergency department visits among individuals experiencing homelessness involve a mental health diagnosis, such as schizophrenia. The impact extends beyond our healthcare system. A USC study found that property values decreased by more than 3% when a homeless encampment was located within 3/10 of a mile of a residence. Between 2016 and 2020, that translated to an estimated $2.5 billion loss, affecting more than 70,000 homeowners. As one can see, homelessness among individuals living with a serious mental illness affects far more than the individual. It affects our healthcare systems, our communities, and the overall well being of Los Angeles County. Now, to address this need, I am proposing a partnership between the Los Angeles County Department of Homeless Services and Housing and LA Family Housing through the creation of the Mental Health Housing Coordination, which I mentioned earlier, the MHAC program. The county will provide oversight, funding, and program guidelines, while LA Family Housing will be responsible for the day to day program operations, including outreach, housing navigation, case management, and housing stabilization. By combining the strength of both organizations, this partnership seeks to close service gaps that neither organization has been able to fully address independently. Instead of working alongside one another, this proposal encourages both partners to work together towards a common goal. Now, the primary objective of MHAC is to provide permanent supportive housing and behavioral health services to individuals experiencing homelessness who are living with a serious mental illness. Unlike traditional housing programs that primarily focus on housing placement, MHAC also emphasizes housing retention and long-term recovery. Now, during the first year, the program seeks to house 100 individuals while achieving an 85% housing retention rate. Additionally, objectives include reducing psychiatric hospitalization, emergency room department visits, and law enforcement contacts, while improving participation, engagement with behavioral health treatment. Ultimately, success will not be measured simply with placing someone in a house or by helping them remain housed, but by connecting them with treatment. MHAC is expected to produce measurable outcomes across three key areas: hospitalizations, housing stability, and law enforcement context. During the first 12 months, the program expects to reduce psychiatric hospitalization and emergency room department visits by approximately 20 to 30%. It also seeks to achieve an 85% housing retention rate among participants while reducing law enforcement contact by approximately 20%. These outcomes are based on research demonstrating that when permanent supportive housing is combined with behavioral health services, individuals are more likely to remain housed, rely less on crisis services, and experience improved long term stability. Now, to qualify for services, an individual must meet the federal definition of homelessness, have a diagnosed serious mental illness, and have either two or more crisis contact with law enforcement or crisis intervention team, or at least two or more psychiatric hospitalizations within the past 12 months. Participants may be referred by county behavioral health agencies, psychiatric hospital, care court, street housing program, law enforcement, county jail representatives, and county crisis assessment team. Services provided through MHCC include outreach and engagement, housing navigation, linkage to a mental health provider, medication support, linkage to temporary and permanent housing, security deposit assistance, and limited rental subsidy assistance. MHCC will consist of one service chief, two licensed behavioral health specialists, five housing navigators, and one specialist. Together, they will coordinate housing and behavioral health services to help participants remain housed. Now that we discussed how the program works, I would like to walk you through how it will be implemented. Once a participant is referred to MHHC, the staff specialist will review the referral to determine whether the eligibility criteria has been met. If approved, the case will be assigned to a behavioral health clinician and a housing navigator. Together, they will begin outreach and engagement with the participant. The behavioral health clinician will confirm that the clinical requirements for participation, while the housing navigator will begin searching for temporary housing and linking the participant to mental health services. Once temporary housing has been established, wraparound services will be provided through a contracted provider. The housing navigator will then assist the participant in locating permanent housing. Once permanent supported housing has been secured, the navigator will assist with the security deposit and short-term rental subsidy. During the first 6 months of housing, MHAC will continue to monitor the case while helping the participant identify other options for paying rent and renting house. Now, the estimated first year budget for MHAC is approximately $2.27 million. The majority of the funding is dedicated to housing assistance, including security deposit and 6 months of rental assistance for 100 participants. Personal costs include one service chief, two mental health clinicians, five housing navigators, and one staff assistant. Operating expenses include administrative support, office supplies, technology, mileage, training, and other program costs necessary to operate the program. Behavioral health treatment services are not included in this budget because participating providers will be able to bill Medi-Cal and other eligible insurance programs. Now, this allows county funding to remain focused on housing stabilization and participant support. Now, as I conclude today's presentation, I would like to return to where I began. A tapestry is strongest and most beautiful when all of its threads are woven together. Society is no different. It reaches its full potential when all of its members are prospering and receiving the support they deserve. When individuals experience homelessness and serious mental illnesses are left without stable housing and behavioral health services, the effect extends far beyond the individual. They are felt throughout the entire community. Tackling such a complex issue requires more than the efforts of a single government agency or nonprofit organization. It requires collaboration. The Mental Health Housing Coordination Program provides Los Angeles County and LA Family Housing with an opportunity to better serve one of our community's most vulnerable populations. By combining permanent supportive housing with behavioral health services, MHAC seeks to improve housing retention, reduce reliance on crisis services, and strengthen our community. By investing in coordinated housing and behavioral health services, Los Angeles County is investing in its people, its community, and its futures. Because by strengthening one thread, we strengthen the entire tapestry. Thank you for your time. I am more than happy to answer any questions. Thank you.